Welcome to RR Nursing Zone. In this topic we discuss about the stress introduction. Stress is a type of psychological pain. Small amounts of stress may be desired, beneficial, and even healthy. Positive stress helps improve athletic performance. It also plays a factor in motivation, adaptation, and reaction to the environment. Excessive amounts of stress, however, may lead to bodily harm. Stress can increase the risk of strokes, heart attacks, ulcers, and mental illnesses such as depression and also aggravation of a pre-existing condition. Definition of stress. Stress is defined as a complex set of reactions to real or perceived threats to one's well-being that motivates adaptation. Stress is a feeling of emotional strain and pressure. Stress can be defined as any type of change that causes physical, emotional, or psychological strain. Common causes for stress. The situations and pressures that cause stress are known as stressors. Common external causes of stress include major life changes, work or school, relationship difficulties, financial problems, being too busy, children and family. Common internal causes of stress include pessimism, inability to accept uncertainty, rigid thinking, lack of flexibility, negative self-talk, unrealistic expectations, perfectionism, all or nothing attitude. Types of stress. Acute stress. Acute stress is a very short-term type of stress that can either be positive or more distressing. This is the type of stress we most often encounter in day-to-day life. Chronic stress. Chronic stress is stress that seems never-ending and inescapable, like the stress of a bad marriage or an extremely taxing job. Chronic stress can also stem from traumatic experiences and childhood trauma. Types of stress. Episodic acute stress. Episodic acute stress is acute stress that seems to run rampant and be a way of life, creating a life of ongoing distress. Eustress. Eustress is fun and exciting. It's known as a positive type of stress that can keep you energized. It's associated with surges of adrenaline, such as when you are skiing or racing to meet a deadline. Signs of stress. Psychological signs such as difficulty concentrating, worrying, anxiety, and trouble remembering. Emotional signs such as being angry, irritated, moody, or frustrated. Physical signs such as high blood pressure, changes in weight, frequent colds or infections, and changes in the menstrual cycle and libido. Behavioral signs such as poor self-care, not having time for the things you enjoy, or relying on drugs and alcohol to cope. Stress-influenced conditions. Diabetes, hair loss, heart disease, hypothyroidism, obesity, sexual dysfunction, tooth and gum disease, ulcers. Techniques of stress management include: identify the sources of stress in your life. Practice the 4 A's of stress management. The 4 A's: avoid, alter, adapt and accept. Avoid unnecessary stress. Alter the situation. Adapt to the stressor. Accept the things you can't change. Get moving. Connect to others. Make time for fun and relaxation. Manage your time better. Maintain balance with a healthy lifestyle. Learn to relieve stress in the moment. Thank you for watching this video. Please subscribe for updates.